expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Dr. Anothony Pannozzo and Freddy Fixit Santory present Health Sports Sense. They have combined to bring you a revolutionary approach to pain treatment, which allows fast and effective treatment for pain without narcotics, surgery, physical therapy, manipulation, or other alternative approaches. Dr. Pannozzo is a world-class leader in the treatment of sport injuries, work injuries, and other common pain syndromes. Freddy Santory discusses the doctor's pain syndrome solution, which is based on engineering concepts and the underlying physics of weight bearing in motion. These methods restore a normal physiology for weight bearing and will provide a normal range of motion without pain. Call in and be part of the show at 888-721-0074 and learn how to gain 40 yards on your golf game. Health Sports Sense combines medicine and video technology to bring you the most advanced way to get you back in business. Now, here's Dr. Anothony Pannozzo and Freddy Fixit Santory.
Good afternoon, everybody. This is Freddy Santory, Freddy Fixit as they call me. And Dr. Pannozzo is not in studio, but he will be with us on the line. Physically in his place, we have Les Mayer from Health and Wealth Seminars.
Hey, Freddie, how's it going? Good to see you again.
Good. How are you?
I'm doing fantastic.
The doctor, you got him so busy that he could not make it into studio.
I know,
today.
so evidently we're doing the right thing. What he does is the most incredible thing. I mean, I met him once and I was totally blown away. He actually can give you 40 yards on golf. I've seen some of the pros that he works with, seen some of the athletes he works with, and everything that this gentleman says is absolutely the truth.
Well, we're gonna get to that in a second. I just want to tell the people out there, those that are expecting the Scott Shavish Show, the Digital Power Hour, will be on at 12:30, right after us. You can catch us streaming live on Wsbr 740 AM Money Talks website. You just hit the TV button. They have a TV station going now. And you can catch us, of course, on 740. Also, let me give in the call-in numbers. So in case anything of interest comes up on the conversation that we're about to have, you can call in on 888-721-0074 and locally 561-995-8255. Okay. Now that we got all of that out of the way, and also get a piece of paper and a pen, because I know that being Florida, Les, there's a lot of people that love the game of golf.
Oh my God, it's amazing! And golfers will spend $600 on a club, lots of money on balls. But you know what? Here's a guy that could tell you don't have to spend all that money on your golf club. Let me show you how I can help you increase your yardage by 40 yards. I mean, to me, that's phenomenal. As a golfer, I understand that.
It is, and it's not only golf, but it's anything in sports or anything that you do that in nature of work.
Oh, even tennis.
Tennis, or just working and having mobility. And we're going to ask the good doctor to give us a brief explanation to what's going on with that. I know that he's been interviewed by a lot of medical people and people in the field.
Yes.
But me, I'm not in the medical field. I am a regular guy. And what I want to do is I'm going to approach this with the doctor as a regular guy who's looking for help and pain management. Because one of the interesting things that you pointed out to me, Les, is that even if there is no pain management, he can help you improve your swing and everything else.
Oh, we have a guy that a good friend of mine who was told to go for back surgery.
Exactly.
Dr. Pannozzo has been working on him, and the guy's actually being able to walk. His functioning is like 90% better than he was, and he doesn't have to go for surgery. And we all know what happens when you go to a back surgeon.
Exactly. Now, is Dr. Pannozzo on the line? All right, let's put the good doctor on there.
Hi, Dr. Pannozzo. This is Les. I'm here with Freddie, so he's going to ask you some questions.
Oh, nice to hear from you. How are you?
We're doing good.
I hear you're so busy you forgot about me.
No, I didn't forget. I just got overwhelmed today. I couldn't leave.
That's okay. Even better.
That's okay.
The patients are first, you know.
Oh, yes.
You got to take care of the people.
No, I understand. And now we met briefly. I wanted you to give us an intro as to some of the stuff that you do, and it's non-surgical. There's a lot of nons in this procedure, and the mobility and the physics part of that. Can you give us a brief description of what you do?
Yeah, well, you have to learn how to take a history, and in other words, what are the right questions to ask somebody about their pain? So a person who has a back pain will say, well, it hurts all the time everywhere. Well, it really doesn't. So you have to know how to analyze that and put it into some kind of perspective. And then you have to be able to examine for it. And the examinations we use are just based on the anatomy. I mean, there's nothing spectacular about it. It's the body does certain things, and so we test those certain things. And if something cannot be done, then that is a painful situation. We can fix that. And then by redoing the examination, we know whether we got a cure or not. And we do that in the office at the same time. I have a sign on my wall that says you cannot leave this office with the same pain you walked in with. And that is, think about that. So that means that I have to really work at it, you know.
Okay.
But I don't mind. It's really good stuff.
Okay, now let me ask you a question. A lot of people are going to say that this is too good to be true. They're going to say that what Dr. Pannozzo does, nobody else does. I mean, I've never heard of anybody being able to guarantee 40 extra yards on your golf game. I do understand, because I have interviewed him on another radio station, I do understand the physicality about it, you know, physics and how you improve the swing and mobility because you're reducing pain and everything else. But give us a little bit more. What kind of instruments do you use to get this thing, to find out what's going on, which is the first part of the problem?
Well, we don't. There's no instruments. It's a clinical exam and a clinical history. This is what a doctor's supposed to do, not read an MRI, but examine the patient. This is all basic medical stuff. And when you take the physiology of, say, the shoulder, how does it work? What is it supposed to do? Then you can pick up what it cannot do, and then you fix it so it can do it. It just works like that. And there's principles of cause and effect. Some things cause pain, some things don't. You have to think about primary and secondary issues in pain. What's a primary cause? Even though you may not feel it there, you might feel it somewhere else, but you have to know what causes that pain. So there's a primary and secondary issue also. You have to know that. You have to know the anatomy. You have to know how it works, which is the physiology. These are all fancy names, but really it's how the bone structure is there, how it works. It's connected by ligaments, and nerves are rarely an issue. So, but we can examine for that also.
Okay.
So really it's basic stuff, and nothing strange about it. It's just state of the line. It's what should be done. Everything else is to my mind, is alternative. For instance, if you use an MRI to diagnose, that's an alternative. The patient is the one who dictates how you diagnose it, not the X-ray. You know, I learned the first year of medical school that X-rays are to help you, but not to diagnose. You must do that on a clinical basis. And you know, how many years ago was that? But it's still true today.
Gotcha.
Then what we look for is, if you can't bend forward, okay, that's your main problem. I have to find out why you can't bend forward, and then we have to do something with that. And if we're successful, you will bend forward, right in the office. That's how you know you got a cure. That's why it's not too good to be true. That's the way it works. You have to experience it. And you know, when you have different thoughts out of the box, it takes people take a little longer to look at it. But hey, look all you want. This is the main thing. This is the real thing, and we're pretty proud of it. We have offices here in Phoenix. And anyway, if you wanted to know something about the golf swing. The golf swing is based on all kinds of moving parts working together in sequence. So that's the first thing. And how does that club head get around at maximum speed to get that ball somewhere? Well, everything has to work in sequence, and it has to be pain-free, and you have to be able to mobilize all the areas necessary to make that turn. So it's rather complicated, but I spent 3 years down here with Bob Tosky, and we learned what how the golf swing actually takes place. And usually, from my point of view, the golf swing is a natural phenomenon. if it's pain-free. Now, if you have a problem, a pain, then it will be abrogated. In other words, that arc that you're making with the club head to hit that ball will now not be smooth but be ratchety. And that's why the ball goes here and there and you can't control it. Now, once you take the pain away, then you get back to normal again. But what's happening now in the business is that the professional golf teacher will take somebody with a disability like that and try to correct it, but not correcting the anatomy or the physiology, the medical part. And so now you have two disabilities that you have to worry about. And that's why people forget momentarily what they're supposed to do, because it's rather false. My idea is to make it all normal so you don't have to think about it. And then you think about how you play the game.
Gotcha. On the show here, the new show, the Health Sports Center with Dr. Anothony Pannozzo. Anthony, your phone number is 561-381-5800. Is that correct?
Yes, sir.
Okay. Now, I wanted to touch real briefly on, I just started to play golf, and I'm playing against my 22-year-old. And to be honest with you, I do have, I have a little bit of diabetes, and it sort of gives me pain in the hands and in the shoulders and everything else. And I thought that I had a rotator cuff tear, and I saw an interview where someone asked you about that, and you said that that really isn't what's going on. Can you elaborate a little bit on that?
Well, it's commonly read as a tear, but think about it. How do you tear a ligament? You can't tear a ligament. You'd have to fall from the Empire State Building to do that.
Gotcha.
You have a sprain of a ligament, you can have that, but not a tear. I mean, that's overreading. The shoulder is examined for its major parts, and most of the time it's just connective tissue, ligaments, holding the bones together. That's all. They get sprained, and you treat them directly, and that's the end of it. Rotator cuff is rarely an issue.
Gotcha. How long does the procedure take once they go in there and you've done your homework on it? How long does it take for the whatever it is that you do to take effect?
2-3 minutes.
That's it?
Wow, that's true.
That's it.
So let me ask you a question. I'm 51. My son has about 40 or 50 yards on me, and it has to do with pain. I know what the deal is on me. So if I go to see you, I can probably catch him in a couple of weeks, you think? Because I'm sure I've developed bad habits to compensate.
Well, first of all, his reflexes are a lot faster than yours.
Yes, they are.
At his age. So you have to contend with that. But I would say that you should be able to keep up with him anyway.
I see. And that's important. So out there, I know Florida, golf fanatics less. You're a golf fanatic.
Oh, yes, I know.
And people that they want to play the game and they're hurting and everything else, and slowing down. Now, Doc, is there any side effects to what you do? That was one of the questions that came in on the chat room.
No side effects at all, except if you're a diabetic, it raises your blood sugar 12 hours and then goes to normal. The medication is very short-acting, so we don't expect it to do anything to you, except relieve the inflammation where I aim it. Now, you have to understand that these are very small doses of a steroid drug, which is anti-inflammatory, and it has to be placed properly or else it doesn't work. And so that's incumbent upon me to know where to put it. So it's not the drug. Everybody wants to know what's the drug. It's not the drug. It's where and why it's used. That's the nub of it.
Anthony, last night I was at a function where I met a lot of ex-NFL players who, these guys, forget about it, they can't even walk straight. They're in such agony of pain, and they have pain everywhere. And I put your name out there to, I don't know, maybe 30 ex-players that were at this function we were at. They were shocked to hear that this could happen. And what I want the people out there on Radio Land and TV Land to understand is that this is totally different from what you're seeing going on right now in the news with A-Rod, where they're using enhanced steroids, and they're using all sorts of cheating mechanisms and surgeries and everything else to compensate for strength. This is completely different from that aspect, correct?
Oh, absolutely. It's not even the same compound. We're using an anti-inflammatory drug, and they're using a protein enhancement drug, in other words, to make muscle. It's completely, absolutely different, and not to be confused.
Exactly. And I want them to understand, because I know that your website is paincentersnationwide.com.
Yes.
And I want to make sure that everybody on there understands the difference between what's going on in the news right now with pain centers and what you do. It's a very big difference, absolute big difference. You compensate for pain in every sport, whether it's football, baseball. I mean, I've seen it myself. And me and the good doctor talked about, he knows where things are. Because how many years or how many patients have you had going for you, Dr. Pannozzo?
Well, we're going on 46 years and 66,000 patients.
That's amazing. And the thing is that you're the best kept secret. And I know you're not a secret, because everybody who I've spoken to in Les's world knows about you. But in my world, everybody's looking for Advil or using a shot in the shoulder. Now, there was something that came in on the chat box also that said people, they use anti-inflammatories and they take like 25 shots in the region. Is that one of the things you do? Do you have to take this over and over again?
No. Once the range of motion is obtained, then it's secure. You don't need any more treatment.
Unbelievable. Unbelievable.
I was there when he had a patient, and the guy couldn't pick his arm up. He had one treatment. The guy said, "Oh my God!" He was walking, waving his hand, doing everything. It was amazing. People don't realize that this is absolutely amazing what this man does. Again,
Dr. Anothony Pannozzo's phone number is 561-381-5800. And when you walk in there, let them know that Freddy Fixit sent you. Unless we've been doing this now 3.5 years, and we've been putting on the air thousands of interviews looking for answers to different problems and trying to get to the basics of what doctors do, so that it's not a pharmaceutical gag or something they want you to buy over and over again.
Correct.
The good doctor here, his procedure is that when he fixes you, you're probably not going to come back.
I know. I said to the doctor, I even asked him about it. Here was a guy, and he said, "When do I come back?" He said, "Probably never."
I know, which is an amazing part of medicine, because, they want you to come back.
I have a friend that you met, I won't mention his name, that was told 3 times to get a hip replacement and back problems.
Yep.
He's been to Dr. Pannozzo, and I've actually seen him, and he's walking.
Right.
And he has virtually little or no pain.
Now, Dr. Pannozzo, as you know, I said before that I do have diabetes. I don't have injectable diabetes, but I'm still on medicine. And there are things that are happening with my feet and my hands, numbness and things of that nature. And I've been told, and again, it doesn't mean that what I've been told is correct, but I've been told that there's nothing that can be done except alleviate the pain by taking Advil or Tylenol or things that for short stays. Will this procedure help me?
Yeah, you have to be examined. Now, you can't just go to any regular medical doctor, not even an orthopedic surgeon or a neurologist or a rheumatologist to get this approach. They just don't, it's not in their training.
They don't do it.
So when your family doctor says to you, well, there's nothing can be done, well, he doesn't know that. He's assuming that on his limited knowledge. And now he should, get another opinion, and we could usually find something wrong to treat. Now, you can't have symptoms like that based on diabetes. It's not possible, especially your kind.
Okay.
So I would dispose of that right now. That is not your problem.
Okay. Well, I'm gonna be seeing you. I know I told you a couple of weeks I was gonna go up there, but you kept me busy the last couple of weeks. But I'm gonna definitely, this is a call out to people in the golf game, because I know this is a heavy golf community.
And the tennis players.
Tennis players with the tennis elbow. Tennis elbow, Doc. Tell us a little bit about how that's done. How's that repaired?
Well, there's a couple of. Can I tell you a story about the shoulder first?
Okay.
We treat a lot of tennis players. So a patient of mine calls me and he says, "Oh, I hurt my shoulder and everything's ripped out." I said, "What do you mean ripped out? How is this possible?" He said, "My MRI says it's all ripped out. Tears everywhere." I said, "You better come in." So he came in, I examined him, put one shot in his shoulder, and he walked out using it. You can't go by that kind of thing. You have to go by superior examination. Remember, the physician and you are a team. The patient and the doctor is a team. You have to understand what he does, and the doctor has to understand what's necessary to take care of that person. So that's the way I look at it. That's why we don't have any other people here treating people. It's just the doctor and the patient. So it's a very personal way to do things, and it has to be done correctly. I want to tell you a story about about a professional football player from the Dolphins.
Okay.
He came in here with a low back pain. They carried him in, and he walked out. Gave him 4 shots in his back, and he walked out. Same day he came in. No surgery because he was going to operate the next day. So I saw him again, and he said, I would have bought you a Ferrari if you kept me working one more year. And he lost $11 million.
Wow.
One more year.
That's amazing.
That's the kind of work we do. Now, I fixed this man in one day. And
Okay.
that's the reason he couldn't play anymore, because of his low back pain. And I fixed him in one day. So when he says to me, I'll get you a Ferrari, I said, hey, that's my new price,
Wow.
I want me to treat you, it's a Ferrari.
Wow. Well, don't scare people away, Doc, because they're going to think it's a fortune to come see you.
No, it actually isn't. Most insurance covers it pretty good.
Okay. And what I'm hearing is tops maybe 1 or 2 visits if necessary, but mostly done on the first visit?
Yeah, that's right.
Amazing. Amazing. Here with Dr.
We don't really schedule people to come back unless there's a particular problem that I know of. If we haven't done the whole job, then we have to have them back. But usually I say, look, I'm here every day. If you have a problem, you just call me up and then come in. I'm here for you. You're not coming in for me. If you don't need it, don't come in.
Amazing. On the air here at WSBR 740 with Dr. Anothony Pannozzo. I got another question that came in on the internet, and I know that you've spoken about this a number of times. Migraine headache, something as simple as a migraine. I know somebody that had a migraine for 2 or 3 days, which I've never had it that long, but it does exist, yes?
There is what they call a migraine, and we know now where it comes from. You see, everywhere else, I did research on that. Just finished it about 6 months ago. So we know where it comes from, and it's all in the neck. Now, usually what's being treated is a symptom. A headache is a symptom. It's a referred pain from somewhere. And if you understand how physicians think, you have to have something that you can look at before you can treat it. So they've been getting away with treating migraines all these years and not knowing where it was from. So now we figured that out, and any migraine can be treated, and it takes 1 or 2 days.
Wow, that's amazing. I mean, that's just amazing.
Now, that's not available because we didn't publish it for other doctors to see. But essentially, that's what you're looking at. You say, what causes my headache? They'll say migraine. Well, that's not a diagnosis. You need a location.
Now, let me ask you a question. That brings up an interesting point. If I were to have a handful of doctors who have been treating patients, let's say for backaches or knee pains or arthritis, how does arthritis, how would that be treated with your procedure?
Well, what people call arthritis is actually an injury repair process. The term doesn't mean much because it doesn't tell you where. It means a pain, but it doesn't tell you where. Well, most physicians don't actually do this kind of work. They attempt it, but not enough. We actually go full blast into this thing. This is all we do. That's all I've ever done for, I don't know, all these years.
And it's non-surgical, non-manipulative. I mean, this stuff is, you find the problem, you isolate the problem, and you attack the problem, correct?
That's absolutely correct. You can't get relief until you know where you're treating. We do the same. No, it's got to be good.
Yeah, and the training is important because you have that keen eye. So once somebody comes in, you've seen it so many times, you're probably familiar with where it's happening. Even though everybody is different, slightly different, you probably can pick up what's going on and how it's going on and be able to resolve it.
Yeah, that's precisely right. We had a fellow come in here today that his neck fused years ago and had another pain. They were going to do another fusion higher up. I said, wait a minute, that's not where your problem is. It's lower, and which we treated, and he was very happy. The same day this morning, he had relief of his major symptom that he had for months. So, there's a lot to this, and it's very scientific, very basic, very good medicine here.
Amazing. Simply amazing. Dr. Pannozzo, 561-381-5800. Get in there and make an appointment. If you miss out on this, I mean, 40 yards on your golf game is one thing, but if you're having all sorts of procedures done, get a second opinion. Call this man. Okay? It isn't going to cost you anything to call him, and it may change your life from what the footage and the stuff that I've seen, people that he has taped and things that I've seen. It's an incredible story. I mean, this is unbelievable. This is stuff for 60 minutes.
It's amazing. It's absolutely amazing. But people don't realize when you meet the man, he's so dedicated. He cares more about alleviating a person's pain.
And the only other person that does it with the doctor is his son in Phoenix, Arizona.
Yep. We were gonna. I hope we could get him on the phone and we could have a two-way conversation.
Absolutely, and I look forward to going to the good doctor. Give us the address of your place. I forgot to put that on the lower streams real quick.
Yeah, it's 16244 Military Trail, Delray Beach, 33484.
Excellent. Okay.
And it's Suite 740.
740. Beautiful. All right, we're out of time. The Health Sports Center show will be back next week.
With Dr. Pannozzo live, hopefully.
Absolutely. And we will cover more of this stuff. And you have a good week, and we'll see you guys next week, 12 o'clock on Wsbr TV.
You have been hearing and watching the Health Sports Sense Show with Dr. Anothony Pannozzo and Freddy Fixit Santory. Tune in again next time to learn how this effective treatment of pain without narcotics, surgery, physical therapy, manipulation, or any other alternative approach will increase your work and sports game to a new level. Join us next time for another episode of Health Sports Sense. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.